Hello my dear friends. Today we will discuss about which doctor we should consult when we have panic attack and then after panic attack when we have panic disorder. So please don't forget to subscribe this channel. I will be coming with lot of such positive videos which you should see, and if you want to see them in time you should support my channel. Please subscribe. When we have panic attack, we all know the symptoms of panic attack is little bit horrendous. We all know about it. We will be having faster heartbeat, palpitations. May have sweating. We may have shivering of hands. Our breathing will be much faster. Sometimes we may feel breathless, and we will be doomed. We will think that I am going to die now itself. So what is the basic thing we are supposed to do when we have panic attack? Everyone knows we will be rushed to casualty in a hospital. Either we ourselves will go or somebody will take us to the casualty. So we should know what treatment they are going to give you in casualty. Casualty, the doctors available in casualty are critical care medicine specialist. Critical care, first aid. So what they are doing? They are going to check you up with the help of maybe ECG or some blood test. They will check the BP. They will check your heartbeat, pulse, all those things. After that, when they are confirmed that you don't have any cardiac problem, cardiac arrest, you don't have any other critical care problems. So usually after panic attack, they will tell you, the doctors will tell you, you don't have to worry, you don't have any symptoms which resembles physically, you need immediate therapy or treatment. So there's nothing to worry, you can go home. That's what they are going to tell you. So after panic attack, maybe 1 or 2 hours we will be in the casualty, then we get back to home. The problems arises afterwards. After reaching home, we may be peaceful for some time, maybe for 1 hour, 2 hours, 3 hours and all. But slowly we start thinking about our problem, rethinking about our problem. So in spite of having all these symptoms like faster heartbeat, sweating, all these symptoms mimic heart attack. So in spite of all this problem, I thought I am going to die when I faced with the panic attack. So naturally, I am feeling very, very bad. So naturally, I am going to think the doctors had missed something. The doctors in the casualty, they had missed something. They should have checked something else. They should have checked so many other things. They just took ECG, they took some blood test, and they told me I don't have any problem. How am I going to believe it? Because the symptoms which I faced, they were really troublesome for me. So once I start thinking in that way, most probably second or third panic attack will also come. So you will go again to the casualty. The doctors will check up once again, and they are going to tell the same thing again. You don't have any problem. You might be having panic attack. You may go. Then they may tell you that you should consult a psychiatrist. They may sometimes tell you take the specialist opinion of a cardiologist. That's what they are going to tell you usually. But again, 2-3 times you are coming back to your home and you are trying to relax, but you won't be able to. There's so many other symptoms which comes after panic attack, like headache, tingling in the head, rushing of blood in the head, balance problem, lightheadedness, earache, buzzing in the ear, problems in your mouth, problems in your eyesight, problems in your throat. You may have chest pain, you may have stomach pain, you may have diarrhea, you may have backbone pain, lower back pain, upper back pain, all those. So many symptoms may come after this particular panic attack. Then when it becomes panic disorder, all these symptoms will be troubling you. For each and every symptom, you start fearing those symptoms. For each and every symptom, you are going to search Google or you are going to go with the YouTube. So your symptoms increases, you start fearing more and more, you get confused more and more, you will be fearing more and more. So what is the remedy for this? Usually what we usually do is we go to each and every specialist who is available in the area or maybe faraway areas. That's what you usually do, especially in India. So many people go to so many specialists. For headache, they go for neurologist. For tingling of hands and shivering, they go to the neurologist. Then for ear problem, they go to ENT. For eye problem, they go to eye specialist. For stomach problem, they go to gastroenterologist. For heart, they go chest pain and all, they visit cardiac surgeon, cardiologist. For bone related problems, they go to orthopedician. For each and every fear, each and every condition, each and every symptom, they go to different specialist. So what happens? You will just go to each and every specialist and they check up and they tell you don't have any problem. This could be because of anxiety. So we are going to spend a lot of money visiting all these specialists and taking lots of checks and all. So this is the basic criteria, basic response pattern of a person who is having panic disorder. So we should keep in this mind. Instead of doing this, what we can do? My advice will be, you should consult a general physician, a doctor who has MD in general medicine. He is the person who is supposed to treat you in this aspect, because he will be having knowledge and he will be having experience in all of these problems. He knows about your head, he knows about your ear, he knows about your eyes, he knows about your stomach, he knows about everything, whatever problem I have told you. So he may advise 1 or 2 extra checkups and all. So, but he may not advise you to visit a specialist, especially because he will be making sure that you don't have any problem. Already we have taken the opinion of casualty doctors, critical care specialist, first aid specialist. So they also gave you clean chit, you don't have any problem. Based on that, we are going to consult the general physician. General physician also is going to slowly make you understand why you don't have any problem, why all these symptoms are common with panic disorder people. So first of all, we should have trust on the doctor. So if you want to consult a general physician after a panic attack, and when you start with the panic disorder, make sure you find a physician who is trustworthy. You should inquire about these people, these doctors, and make sure that you are going to visit a person who is trustworthy, because trust itself reduces the symptoms by around 50%. So start trusting this doctor, general physician, go to him, tell him about everything, tell him all the truth, whatever symptoms you are facing, everything. He will understand you, and slowly he may describe you the symptoms to you. He may tell you why these symptoms are coming, why anxiety is such troublesome for you, and slowly he will make sure that you are slowly decreasing your worry pattern and stress pattern. Some of the doctors may even give you some relaxation medicines which help you overcome the anxiety and tension which is associated with the panic disorder. But the trust is important. If you trust that MD physician, and make sure without his advice, you are not going to visit any of the specialists. If you think in that way, these symptoms, as you already know, panic disorder symptoms are always, there's no need to worry about those symptoms. They come because of your own anxiety. So when you are anxious, several such symptoms will come. So if you want to see a doctor for that, you have to visit this physician, general physician first. He will assess you, he will check you and tell you why these symptoms are coming, why you should not worry about it. So all these thing is based on the only thing that is all these advices which I am giving you will be only for those patients, those people, those who are having panic attack and panic disorder. So when there is something else is there that the doctor will find out, the general physician will find out, and if he tells you, definitely you should consult a specialist according to his advice. Thank you for watching this video. Please subscribe to my channel so that you will get a lot of positive advices, positive videos on mental health care issues. Thank you.